This is debate group 5, and our topic is Be it resolved that universal health care be supported in California for the public. I'm Liz, and I'll be reading the pro-opening statement. Universal health care should be supported in California for the public because it will lower overall health care costs to everyone in the state. It will provide essential health benefits to society and give patients transparency when it comes to their medical visits. Healthcare is important, and patients shouldn't feel that they can't afford it or will be in debt for years when seeking medical attention. Kimberly Medeo emphasizes this in her article, Universal Healthcare in Different Countries, Pros and Cons of Each. She mentions that the government can lower these costs by means of negotiation and regulation. By having the government more involved, insurance companies can then be removed. With this change, there is a big portion of administrative costs that can be eliminated since there will only be one government agency they would have to deal with rather than multiple private insurance companies. The lack of universal health care has also played a role in social determinants of socioeconomic status, housing and occupational conditions, and food insecurity. Emphasized in Health Care for All, a framework for moving to a primary care-based healthcare system in the United States. Having healthcare coverage for all people will give us the ability to make sustainable and systematic improvements in access to care, equity, quality of care, efficiency, and cost control. It is evident that there is a huge healthcare inequality and this is a huge problem in the rising cost of medical care. There is this fear instilled in people when they actually go to the doctor, not because of their health, but because of the medical bill that awaits after the visit. Jennifer Nelson discusses many options on how to go about being uninsured on her blog, Doctors for Patients Without Insurance. She reiterates that an average doctor's appointment can run from $300 to $600, depending on the services provided. With universal health care access, these numbers can be cut and the weight of the medical bill and will be off the patient's shoulders. Once universal health care is put in place, emergency room patients will decrease since the focus will shift to preventive care instead of receiving whatever care they can due to their coverage. Universal health care will also provide a general standard for hospitals and doctors. Services can be expected to be provided at low cost rather than only offering expensive services that target wealthy clients for profit.
Okay, so my question to you, Liz, is you say that universal healthcare system is going to lower overall costs for everyone in the state. Personally, I see it increasing the cost as a universal healthcare system is going to be extremely expensive, and the number one way that the government is funded is through taxes. So yes, while people might not have to pay for their medical bills, how is this not going to cause an increase in taxes?
I see your concerns about raises in taxes, but I believe Sarah Fisher had an in-depth explanation for universal health care. In her online article, Medicare for All, Definition and Pros and Cons, she goes on to explain Bernie Sanders' proposal for Medicare for All. In the plans to fund Medicare for All, it was proposed to tax people who are in the higher tax brackets. Fisher mentioned those who make incomes greater than $250,000 a year. Also proposes a wealth tax on the top 0.1% of households. As Fisher stated, if everything were to continue regularly, the combined healthcare spending by private and public sectors is projected to reach $45 trillion by 2026. If we move towards Medicare for All, the cost would be looking at a number closer to $32 trillion over a 10-year period.
Now, let it be known that universal health care should not be supported in the state of California because California cannot afford it, the quality of service will be reduced, and the healthcare workers will see a cut in their pay. The opposition claims otherwise and completely neglects the economic impacts and damage to the quality and speed of services offered. Not to mention the possibility of doctors having their wages cut immensely if a universal healthcare system is supported. To elaborate, as stated by Andre DePietro of Forbes in 2020, the state of California is currently $32.9 billion in debt. California already spends an enormous amount of money towards its healthcare system, and the addition or the continued support of universal healthcare to the state could cripple the economy. According to Frederick G. Brown, the state of California already spends 29%, that's over a quarter of its annual budget, on healthcare, and that number is constantly rising. California simply cannot afford to continue to support universal healthcare in the state. Quality of service is another issue. Countries with public healthcare have reported much longer wait times than those that do not offer. Let's take, for example, our neighbor Canada, who offers universal healthcare to all of its citizens in all of its provinces. According to the Fraser Institute, Canadians had an average wait time of 60 days. That's 2 months to see a specialist. The Fraser Institute also reports that Americans only had an average wait time of 24 days. It's almost a third of the wait time of Canada. This largely due to what scientists refer to as the moral hazard. Moral hazard is when individuals utilize an asset more than necessary because they face no risk or repercussion when doing so. In a study done by Science Magazine, where they focused on 10,000 newly publicly insured individuals, they discovered a 40% increase in emergency room visits. When there is no consequence of overusing an asset such as the healthcare system, it'll lead to a downfall in quality of service and speed. The largest motivating factor for any professional in any field is his compensation. And now a decrease in doctor salary could deteriorate their motivation and then henceforth their performance. Or it could cause the doctors to completely relocate entirely. According to Megan Knowles of Becker's Hospital Review, in her article, 29 Statistics on Annual Physician Compensation by Specialty, general physicians in the UK and Canada make 15 to 51% less than physicians here in the US. So on average, a little less than half of what they make. Why would doctors continue to practice somewhere where they won't be properly compensated? Why wouldn't they just move elsewhere if their wages continue to be cut every year? With these factors in mind, the state of California is in no position or obligation to offer universal health care to its citizens, to continue to cripple its debt, continue to deteriorate the quality of service, and to continue to butcher doctors' pays in the state. Thank you.
Our pro cross-examination question. So would free healthcare not help our economy by boosting wages and salaries, by allowing employers to redirect their money that was being spent on healthcare costs to employee wages, as well as relieving the stress of losing a job or moving between jobs by eliminating the loss of healthcare that accompanies those things?
Thank you for that question. The question being, wouldn't implementing a public healthcare system actually boost the economy because it'll redirect the money given from the healthcare services to the employees? And actually, no, it would not. It would continue to hurt the economy because all that money that's being spent on the healthcare system is being drained every year more and more. So in order for the state to recoup that money, we're seeing an increase in income tax rate every year. So it really doesn't matter even if the wages do increase in these healthcare systems, because they're just going to be continuing to get taxed every year because of just that deficit in the budget. In the UK, for example, where they do offer public healthcare as well as a bunch of other public programs, the average income tax rate of 37%, whereas the average payroll tax in the U.S. is 15.3%. That's reported by the Hoover Institute of the U.S. So if we continue to offer these public programs such as Medi-Cal in the state, we're just going to keep continuing to see an increase in tax rate. It doesn't matter how much they pay the employees, because every year they're just going to get milked in taxes. So there's really no point in increasing the wages if you're just going to lose that money in another way.
Hello everyone, my name is Gurjeet Singh and today I will be doing pro-rebuttal statement. So first of all, let me begin by agreeing with my colleague and that I agree with him. I think that the universal health care system should be supported in California for the residents. First of all, let me begin by saying the one reason I agree with him is because it also lowers overall healthcare cost. Second, it provides essential healthcare benefits to society. And thirdly, it also increases the hospital visits. So after stating this, I would like to respond to my opponent. And as he states that this supporting people having healthcare system, this hurts the economy, it impacts it in a negative way. So let me state this by I do not agree with him that as a taxpayer I already paying these unpaid bills by the patients with financial problems as hospitals. So those are, I believe, taken by, the government health payers because, some people do not have income or they do not work. And that has a higher impact on the economy of California. And instead of going to a medical provider when some of these people are injured or come across some kind of viruses because they are not ready to face those bills or they do not have that kind of income where they can able to freely do or catch this disease beforehand before it gets really critical or endangering anyone's life. So this also triggers emergency medical services to get involved passively to extend patients' stay at hospitals, and that after hospitals, patients may require additional help by other medical professionals. All of this comes to at a high cost. If a patient is unable to pay, there are programs like Medi-Cal that helps patients. So Medi-Cal is a taxpayer's money, so you're covered. And so if that individual can go to a doctor at an initial state, then it would only have a costed in hundreds instead of going to an emergency where it would be in thousands. And the point of healthcare is everyone supposed to be funded by taxing and working individuals, so that way we will have a better quality of life. So according to Public Policy Institution of California, somewhere in 2017, there was an article that states that about 93% of California was covered, whereas back in 2013, only about 83% of California was covered by insurance. So that includes like insurance like Medi-Cal and Medicare's as well. So the second point that I would like to mention that my opponent mentions is that doctors have their wages cut when hospitals don't have enough money. So for that, I would like to talk about an article was written in 2017 there was an article on why become a doctor posted on St. Georgia University. States that studies clearly show healthcare resources will be pushed to their limits in the next few decades, So the income is not always a primary tool for doctors. Some people love saving jobs, saving lives. So it's not always about the money. People are compassionate about these things. They want to make a difference. They want to push people to their limits. So that's what he says. He's like, push it to people to their limits. And so, yeah, we got to be always growing. And healthcare system is one of those things that would have people not think about these kind of things. And so I personally have people, some of my family members, some of my family members that work in healthcare, and all I hear sometimes is complaining about how they had a bad day. But I never had a day where they would be like, oh, I wish I was making more, or because it's just, we all go through those kind of things. And that's my statement. Thank you very much.
My name is Joy, and I will be doing con rebuttal. I think that the United States should not provide universal health care in California because I think that it would only impact us all negatively, especially in the long run. For instance, universal health care in California can potentially result in doctors' pay cuts, quality and efficiency of service and care decline, as well as economic impacts. So in the pros intro, they first mentioned that universal healthcare in California would overall lower healthcare costs. However, I would have to disagree because according to the website thebalance.com, it was an article titled Universal Healthcare in Different Countries, Pros and Cons of Each by Kimberly Amadeo. In that article, she talks about how healthcare costs make up a huge chunk out of government budgets. And I also came across another article on sacramentobee.com titled The Price Tag on Universal Healthcare is in and it's bigger than California's budget. And it was written by Angela Hart. So in this article, she talks about how universal healthcare in California would cost $400 billion per year to be publicly funded, which would mostly be funded by the general public's income tax. So that $400 billion per year, that would cost twice of California's state budget. So that would mean that California would have to look for that additional $200 million elsewhere, which that would not be good for California. That would only overwhelm the government's budget even more. Also, in the pro-opening statement, it was mentioned that universal healthcare in California would provide essential healthcare benefits. But again, I would have to disagree because according to the website businessinsider.com, doctors would have to take a pay cut and would only be getting paid government rates per patient if universal health care were ever implemented in California. Moreover, doctors would not have much space to negotiate their pay rates due to government limited funds. So when doctors get less pay, the quality of the service can start declining, and which patients would have to wait longer to get appointments for doctor visits or procedures in order to keep costs down. And also, people would have only fewer choices when choosing doctors because there wouldn't be as much doctors with different specialties to pick from. So also in the pro-opening statement, it was mentioned that the universal health care in California would give patients transparency when it comes to their medical visits. However, according to the website formosapost.com, universal healthcare reduces the amount of money doctors make. So then there can potentially be a lack of profession, lack of care, and lack of efficiency. And soon it can create a shortage in doctors in the long run. So most of the time when there becomes less incentive, that also means less time being spent on taking care of each patient. Well, all this is due to government limitation on healthcare spending. And so for less time spent for each patient, patients are really only getting the most basic care and need. And according to both websites, formosapost.com and masterclass.com, universal healthcare would also cause longer wait times in getting, whether if it's regular doctor visits or if there's important procedures that needs to be done. And this would all lead to poor patient care due to the shortage of doctors and government limitation.
Hello, my name is Daniel, and I will now be giving our pro-crystallization. So my colleagues and I still believe that universal healthcare in the state of California is a great benefit to our economy and our people. The demand for universal healthcare has been around since the 1940s, when the World Health Organization declared it to be a basic human right. Many wealthy and developed countries like Australia, Canada, France, Germany, and the United Kingdom all have universal healthcare for their citizens based on either the national health insurance, the social health insurance model, and single payer model. The single payer model, where the government provides healthcare through money from income taxes, has worked out for the United Kingdom, the developer of this method. According to Kimberly Amador's Universal Healthcare in Different Countries, Pros and Cons of Each, in 2018, the UK's healthcare costs were 9.8% of GDP at $4,069 per person, compared to the US, who in 2018 had a higher healthcare cost at 16.9% of GDP, making it a cost of $10,586 per person, both averaging a wait time of 4 weeks. To achieve our goal, we will not only focus primarily on healthcare coverage alone, but also on identifying and reducing costs of healthcare services. We will focus on things like prevention and public health, transparency, consolidation, and pharmaceutical and biologics. We need increased investment in preventive care, specifically those that are known to prevent diseases, like vaccines and screenings. Things like this that are known to prevent diseases should not be something we are charged for, especially when it is for the benefit of ourselves as people and to our society by preventing that spread to others around us. A focus on this would reduce future high cost spending for preventable diseases. There should also be a bigger focus on identifying social and environmental factors that contribute to higher healthcare spending. Transparency between healthcare providers and the people will help reduce healthcare costs for all by informing the public about their costs for care and possibly creating more competition in the industry. Consolidation is a concern people hold when they wonder whether they can afford the expensive healthcare or not. When it is needed, this does reduce operating expenses for a hospital but creates less competition to the market, allowing health carriers to hike up their prices. Pharmaceuticals and biologics have greatly advanced and only continue to advance. With this, millions of lives have been saved, and those with chronic diseases have had widely extended life expectancies. Policies should be established so that prices of prescription drugs for those with Medicare are negotiable to allow for an increased use of generic and biosimilar products for those with lower incomes. The crucial points of conflict have been that California cannot afford taking on this decision because it is not affordable, due to the fact that the state is currently in debt, as well as the idea that universal health care would damage the quality and speed of service from healthcare providers and reduce their salaries. The idea here is that debt is not always your enemy. It can sometimes be your friend. Why spend your own money when you could use other people's money? Using debt to finance one's investments can actually bring in higher final balances. By sacrificing, say, higher tax costs, we would gain lower healthcare costs for everybody. Like I stated earlier, statistics show that wait times between the US and UK for healthcare services are about the same. For the wages of doctors and other healthcare workers, most workers are actually known to get into this field for the passion of their job, not for the pay wage. The biggest effect would be on insurance companies, not the hospitals, and workers themselves. Most jobs give private insurance to their workers, which is usually about $7,000 per employee and around $20,000 for family coverage cost. Insurance companies know that if universal healthcare were to pass and the government becomes in charge of it, then they would no longer exist. With that being said, we have presidents in the past try to push for universal healthcare, like Bill Clinton and President Obama, as well as a few 2020 presidential candidates like Bernie Sanders. With their efforts in doing so, we've received outcomes like the 2010 Affordable Care Act, one of the closest things to universal health care that we have. This act relies on mandatory health insurance and charges an individual based on their age, type of plan, family size, income, and location. Close to universal coverage, but not quite it, as universal coverage is where the government pays for basic healthcare services for everyone. California already holds strong nonprofit organizations like Healthcare for All California, whose mission is to achieve universal healthcare through single-payer public financing so that all Californians are guaranteed healthcare. It's an all-volunteer, nonpartisan organization who believe that everybody deserves to be free from the fear of possibly going without needed care because of high medical bills. Everyone should be given health care, regardless of their age, income, immigration status, or health condition. They believe health care should be guaranteed by and for society, just like our police and fire departments, education, and military. We will continue to believe that universal health care is the right thing to do for our people, our communities, and our nation.
Hello, I'm Nick. I'm going to be doing the con-side closing statement. In conclusion, California supporting universal health care for the public is a bad idea, and it should not be supported. For the great expense it's going to cost the state, the poor quality of service it's going to cause, and the effects that it will have on healthcare workers themselves. So having a universal healthcare system is going to be extremely expensive. According to Emma Clark, in her article titled, "What is Bad About Universal Healthcare" from Livestrong.com, she states that in parts of the world that have a universal healthcare system, such as Britain and Canada, they spend almost 40% of their annual budget on healthcare alone. California had an annual budget of $209 billion for the year 2019-2020. 40% of $209 billion is $84 billion, and that is going to be spent on one system alone. With all this money being spent on this one system, it's also going to draw funds from other systems that are already implemented and funded by the government, such as education and infrastructure, which arguably already are not funded enough. And since the government is primarily funded on taxes, this is also going to raise taxes for the average American worker. According to procon.org, in their article titled, "Should All Americans Have the Right or Be Entitled to Health Care?" they state that in the United Kingdom and other European countries that have a universal healthcare system in place, payroll taxes average about 37%, and that is over double what the United States' payroll taxes of 15.3%. And already California is in $33 billion of debt, as Javier stated in the opening. This is just something that the state cannot afford. On top of the expense that it's going to cost, it is also going to drastically affect the quality of service that these patients need for their health care. According to Meridian Paulton in their article titled, "Why a Single Payer Will Make Healthcare Worse for Americans," from the Heritage Foundation, they state that wait times, for example, in other countries such as Canada and Europe that have a universal healthcare system, that wait times for a surgery to get your hip replaced, knee replaced, ankle surgery, shoulder surgery, those are called arthroplastic surgeries, range from 20 weeks to 52 weeks. People may have to wait upwards of a year to get their issues resolved. And this is also because, since healthcare is free, there is nothing stopping people from going to the hospital for even the most minor of discomfort. There is a semi-universal healthcare system already implemented in the United States. And this is in California, obviously. This is the Veterans Hospital. According to the Veterans Hospital's website, all veterans receive coverage for most care services, but only some will qualify for added benefits like dental care. So this is a semi-universal system because it does not give everybody every care. According to Donovan Slack from USA Today in the article titled "Death Rates, Bed Sores, ER Wait Times, Where Every VA Hospital Lags or Leads in the Medical Industry," the median wait time is roughly more than 7.5 hours at almost 70% of the VA hospitals around the country. This is only for a system that gives partial care. Imagine if they gave all care. The wait times would be even higher and the quality would be even worse. On top of these two issues, the last issue is the deduction of wages that healthcare workers are going to receive. According to procon.org, in their article, "Should All Americans Have the Right to Healthcare?" in other countries that have a universal healthcare system, physicians have income 15 to 51% lower than U.S. doctors. As well as with government-controlled system, there's a lot of monitoring. This is already something that is highly monitored, a healthcare system that we have already in California and the United States, but it would just be even more heavily monitored, as well as with their deduction in pay. Doctors and healthcare workers might just leave and we might have a mass exodus of the system, which would cause a shortage in doctors because there are not enough doctors to cover all the patients that need help. All in all, California should not provide this universal healthcare system to the public because they just cannot simply afford it with the billions of dollars they are in debt, as well as the money it's going to suck up from other systems and the high taxes it's going to bring to the people. The quality of service is going to be highly reduced as there's going to be longer wait times and more people. As well as healthcare workers are going to be paid less and treated worse. With all this evidence stated, California should not provide a universal healthcare system, especially because the Veterans Hospital is a proof in the United States and California that this system just simply does not work. Thank you.